most famous physical therapist on the internet.
Well, hi there, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
Together
therapist.
we are the most famous physical therapists on the
In
internet.
our opinion, of course, Bob.
Today, Brad, we're going to talk about the 10 best TMJ exercises to stop pain in your jaw. That's Temporomandibular Joint Disorder, TMD.
Right.
Right.
They call it TMJ, but it's really TMD.
Is the disorder.
Yeah, we're not
Right.
going to worry about the details.
This is an updated video. We did this one in the past, and we're making it a little more condensed, so it's maybe a little easier to follow.
Right. And that one had really poor volume, so this
Oh, it
one
did.
should, this
Okay.
one should be right back up in there so you can hear us well.
By the way, if new to our channel, please take a second to subscribe to us. We provide videos on stay healthy, fit, pain-free, and we upload every day. Also, go to bobandbrad.com. Go to the giveaway section. We're always giving something away. We're always doing a contest. Find out what it is. I don't know what it is today.
Because this is,
A future video.
Right, we don't know when it's going up.
It's also be on Facebook, pinned to the top of the page, Bob and Brad. Short version of us, go to Instagram and Twitter, 60 seconds of Bob and Brad a day.
Say no more, Bob.
So who's this from, Brad?
Pardon?
Where'd you get these exercises from?
Oh, thank you. Oh, well, not the massage part, but the rest of them are from American Academy of Family Physicians.
Okay.
For that TMJ pain, sometimes earaches,
Sure.
headaches, pain when you open and close your jaw, clicks, pops, all those symptoms are common.
The
with
TMJ
this.
is right here and right here. So any pain around this area can be attributed to that quite often.
Right. So the first thing we're going to do to approach this is go after those muscles that are doing the work.
I'm going to stop talking because Brad's going to talk while I massage.
Yeah, that'll be something that we haven't experienced before. Anyways, so we're going to work on the jaw muscle, which is called the masseter, and watch Bob as he does a fine job. Can you hear that on his mic? Mike?
A little bit's fine.
That's all right. So he's going to work in that jaw muscle and feel the muscle. Make sure you're on the muscle itself, not on the bone, and work those muscles up. And then you're going to go the opposite direction and go down. There you go. Feel good, Bob?
Yeah, it does.
Yeah. See, he's happy. He's there. Get a little profile. Now he's got to look at me. I don't feel comfortable now. Anyways, so you can do that. The length of time, it varies. You can go, if it feels good, you can go longer. Then go up and get the temporalis muscle. That's in the temple. That's why it's called the temporalis. But that muscle is like a big fan, and that really does a lot of work with closing that jaw as well. You can, feel it when you chew, and we need to relax those muscles as well. He's going to go up
and going down.
and go down. And then once you get done with that, and it may be, 15 to 30 seconds of each, we're going to do some circles. And get right in there, and you're going to push. You can see Bob, he's got his skin's wrinkling up, not just from old age, either. It's got to do with he's really working that skin and getting into the muscle belly. Also, you can use your knuckles. And you can kind of roll your knuckles like Bob is doing there. I can't do it on my jaw one because of the mic. But there you go. You're going to spend, a couple, 3 minutes and you'll probably be fine. So you get these muscles loosened up before you do the exercises, be a little more effective. You don't have to do it that way, but it can be a good idea. All right.
Did you miss me?
No, Bob is back. Very good. Now the second one, take the tip of your tongue and you're going to put it right behind your front teeth, right where the gum starts and your teeth start, right there on the gum. And then we're going to open and close your mouth 10 times. And you're going to do it within comfort. If it's painful when you get open more, just keep it in a pain-free range. Get done with those, and we're going to go to the next one. The tip of the tongue goes back on the roof of the mouth, so it's back farther. And you're going to start out with a half of a jaw open. So open it up halfway and close it 6 times. And then you're going to do that. After that, you open up as far as you can, but maintain that position of your tongue on the roof of your mouth and do that 6 times. And they're saying these two do 6 times per day as well. How you doing, Bob?
Good.
Yeah, you look like a guppy. They look funny, Mike? Anyways, go through that. So, yeah, you probably are not going to do these in public or in church or anything like that.
People will talk more about you than they do now.
Now, the next one is a strengthening exercise, isometrics. You're going to put your hand, your thumb or your fingers like so, open your mouth about halfway, and then you're going to open your mouth, but you're going to stop that and do isometric. Is Bob out there?
Bob's out there, yeah.
And push down and open and resist it for 6 seconds. And you count to yourself naturally, and then relax. And do that 6 times. Okay? You know, if it gets sore or you get fatigued, you don't have to do all 6. Listen to your body. Now the next one, you're going to close and do an isometric close. So grab that little bony part of your jaw. Some people have more of a protruding jaw there. So work with it what you got and close your mouth, but prevent it and do an isometric close of your jaw. And do that 6 seconds, up to 6 repetitions. There you go. And, you know, and if those muscles are getting a little tired, you can do a little massage after that just to relax them. And this next one's kind of fun. If you have some tongue depressors, or you can use popsicle sticks, but they have to be dry. You know, you don't eat the popsicle and get them wet.
Sure.
Because they have to slide freely against each other. You can start out with 2 or 3. You might need 4. But you're going to start out with a comfortable number of them between and put them, right? Bob, you're going to have to do this because I can't talk. So between your teeth, but you're not going to clamp down on it. It's just loose. You may have to hold them with your fingers so that they don't fall out. And you're just going to take your jaw and go forward and backward with your jaw with a gentle...
Just your lower jaw?
Yeah, just your lower jaw. If you can move your upper jaw, you've got some amazing skill. So Bob is moving his lower jaw forward and back. And you can just leave the tongue depressors slide against each other if that works, but it's not, you're not biting on it. It's just a gentle squish is all. So you're moving that jaw, and the tongue depressors are just guiding it. Is that working for you?
Yeah.
Now you're going to go same thing, right to left to get that jaw moving right to left. We really can't do it and talk. In 10 repetitions of each.
Okay.
And last but not least, of course, we're going to work on our posture. Because posture of your head and shoulders has a great deal to do with the mechanics of your jaw. If you're slouch forward, head forward posture, that does not do anything.
Yeah, try to drink a glass of water with your head forward and slouched.
Sure.
It's very difficult.
Right. It changes everything in the throat as well in the jaw. And some people will affect more than others. So shoulders back, good posture, and we're going to do 10 chin tucks. Chin going in and back, so it's not down like this.
Not up.
Yep.
This is straight back.
Straight back. Do the profile like this. And those you can do as much as you want, but we like to recommend every 1 to 2 hours do, 5 of them or so. You can do it while you're driving, when you're sitting at the computer, when you're watching TV. It helps you remind you of those. Oh, Bob.
I used to make these as a kid all the time.
Yeah. Wow. Broke right apart.
Yeah, we used to make them little bombs, stick bombs. So.
All right. Well, good luck with that, TMJ. And again, approach this not too aggressively, because you will get those muscles tired easily. It's amazing.
Start it slow.
Good
Thanks
luck.
for watching.